Now we have types of pancreatitis, acute and chronic, and there is another entity called as recurrent acute pancreatitis. Acute pancreatitis is one such where it happens in a short time, probably without any such episode in the past, and there are certain characters and criteria to call it as acute pancreatitis. Acute pancreatitis is diagnosed based on certain blood tests, the history given by the patient, as well as the imaging features. Imaging in the form of some scans which are done to establish the diagnosis of pancreatitis. What if it is not treated? Certain complications may arise out of pancreatitis, which can include the involvement of the pancreatic duct. There is a certain duct, the pipe system in the pancreas, which will bring out the chemicals produced in the pancreas to the intestine. Now this duct or the pipe may open up at some places, causing accumulation of the fluid, the content in the stomach, or it can form a well-formed collection, or the nearby blood vessels may be affected, causing blood clot in the vessels. These are all complications of pancreatitis. Certain people with extreme form or severe form of pancreatitis go on to develop breathing difficulty or renal issues, which is called as multi-organ dysfunction. So it may be in extreme cases lethal. Somebody may have high mortality or high chances of succumbing to this illness. Now what is chronic pancreatitis? This has been there for some time with recurrent episodes of stomach pain, discomfort. Many people confuse this for gastritis. How to establish? Based on the scanning, then there is some evidence of calcification, that is stone formation, or the change in the pipe, that is the duct parameters, and then parenchymal changes. Now the chronic pancreatitis has endocrine and exocrine insufficiency, which may be a cause for diabetes, which is as well known as pancreatic diabetes, where the insulin production or the function of the pancreas is less. As well, they have digestion issues in the form of steatorrhea. How to handle pancreatitis? After establishing the diagnosis, the way of handling acute and chronic pancreatitis is different. First thing starts with removing the cause for pancreatitis. Alcohol, tobacco consumption should be absolutely stopped, and whatever the possible medications that are causing pancreatitis should be taken off and replaced with alternate medicines. As well, the gallbladder stone should be taken off. Once the cause is taken care, then the complications which may be arising out of this should be handled. If there is water accumulation or a cyst formation, endoscopy therapy may be required in the form of ERCP, that is endoscopic retrograde cholangiopancreatogram, wherein a stent is placed into the pancreatic duct to prevent the leakage of that liquid or the pancreatic secretion into the stomach. So once the stent is placed, the leakage stops. This is done by endoscopically, wherein a tube is passed through the mouth into the food pipe and stomach and the intestine. So this is without any scars on the stomach. This is the advanced therapy for pancreatic disease and its associated complications. Pain management is also equally important in pancreatitis, which is done by injections or oral medications. Subsequent follow-up and healthy lifestyle is definitely required in most of the people with pancreatitis. So, for more information, please visit medical hospitals at Maidur, Maidur, and take care of your pancreas. Stay healthy. Thank you.